Hello everyone and welcome again to our channel. In today's video we will try to explore two important websites which they are in the medical field. Those two websites, they can be very useful for doctors, also for patients if they need to chat with an AI, which is like they have their target with medical consultation. So they are made for medical, they are not made just for general information. So let's, rather than just to speak too much, let's go and try to explore it. So you can use it if you are a patient or you have some of your family or related or friends, they are having some diseases. You can just put the symptoms and maybe they can give you some recommendation and they can diagnose for somehow. But this is not confirmed. You need also to check with your doctors for like final consultation, but this is an AI which is very important for medical field and in the recent time, and we are seeing some doctors they are start to use it and they are praise those websites. So let's go with the first one, which is Double I Medical, and you can go here, and if you just click here in the first link, this link, you will have here, you need just to sign up. I have already signed in. So you need just to go back. Those are some diagrams, some descriptions, some information about this websites. But you need just to have Hugging Face. I will just go down until I have it. It is very down. Let me just go down. It's a lot. They have diagrams, some diagrams you can read, especially for doctors if they are very important, curious or interested to understand what's this and this benchmarks. Here, if you go before the references, you will have the resources. So this is Hugging Face. You need to sign up and to have an account in Hugging Face to have the access to this website. Also the other websites, there are many in Hugging Face, but you need to have a Hugging Face account, and this is very important also, like for this website or for others. So you just need to click here. When I click here, now I have this. So you can see here we have the I Medical 8P, and you can see here what I need to tell you. Here you can just put some text generation. So you need just to describe something, then you send it, then you will get back what's the results. So let me just go for an AI. I will try to put any symptoms, any disease. I will try to ask him to make it somehow difficult. Then we will see how they will react. So let's go and see what we can do. So let's assume those, the symptoms. So I will copy them and I will put them to this websites. It has been already done. I have just pasted them here. Then I will go for send. Then we will be waiting until we get a result. And you can here read until they have reasoning here. You can see and thinking for almost 4 seconds. It's mentioned 5 seconds. I'm not pretty sure if you can see this or no, but we will have the results. And here you can see the newest advanced large language model developed by Intelligent Internet, and this is for medical reasoning, AI driven for medical reasoning. So let's wait and see what they give. So here they give the answer. You can see here the answer they give. It can be useful if you feel they are how can I say it? I don't know how can they say it in a medical term, but if they are touching what you feel, so this is a good point. So those AIs, they have been made for medical more than a normal chat. Let me just try it another one. I will give it another prompt, but this is, I'm unsure if this is the right or wrong, but I just ask an AI to give me a symptoms for any disease. They give me this one. What I give, this is the symptoms we have given, and this is what they finally the important notes: diagnose treatment, and they mentioned the lifestyle adjustment they need to do it, and they mentioned this is prolonged and untreated. So something that maybe you need to, and they said here, seek medical care without delay. So maybe this is act immediately. So you need to do it, as they said here, maybe you will have kidney failure, and this is, or neurological issues, and this is very important to you to put it. But maybe they have just exaggerate. I'm not pretty sure, but it depends from your cases. So what case you have, just put it and we'll see. You can see more if it is accurate or not. So let me just try, instead of try another one, diagnosis or symptoms, I don't know. So maybe doctors, they can help in this more. If anyone of doctors, they are watching this video, maybe they can try it and let us know their feedback. But let's, instead of just try it again, let's to go to another AI website. This is another AI website, and this is for also medical, and the same way it has, but we can call it here MedGemma. This is what I believe they call it. So you just press the first link, and here you go either to Hugging Face, which is, I preferably ask you to do it, because Hugging Face, you need to have an account, especially if you are like interested in AI. So we'll go here and we'll just click down face here. So after we go to Hugging Face, we just click, then you will have it directly. It will comes to you. You need to click nothing, but here go for the last updated one. So I'll click here directly in the last updated one. So this is the same, almost the same way, but here from image to text, you can see here from image to text, image text to text. So this is also fine, because you can, from here, you can do any attachment you need. But it should be an image, and it should not be that large. For example, if you have X-ray, if you have, for example, MRI, if you have any image you want to just support your symptoms, you can do it. So what we will have do now, we will just go again and we will try to get those symptoms again. I'm not pretty sure, so we'll take them again and just will put them here. And as I said, if you have attachment, just put the attachment here, and this would be very helpful. Then we will see the comparison between the double I medical and this MedGemma or MedGemma, whatever. So we'll click here, and we will see. According to the last updates, just to give you information, this MedGemma, it's recent, more recent maybe, because it has been updated lately, but here they said it is failed to perform. So while streaming responsible does not exist, so let's try again and see what's the problem. So they said the model is busy, so they said also try again later, but we'll try again here the same until we get some results, because this, they said also new providers. Maybe if we go for like not the latest update, maybe we'll get an answer, but I am very interested to use this until we get an answer before we jump to any like other try. You can see here it started, we give him the same prompt, like after 2 times of trying, they give us more. I can see here somehow it's more detailed than the other one, but also you can here see, I can see this is kidney involvement, so maybe they have similar. So what you do, a doctor needs to evaluate your symptoms, perform necessary tests, provide accurate diagnosis, treatment plan. Don't attempt to self-diagnose or self-treat. This is what I like. They said, don't try to diagnose yourself or treat yourself. Early diagnosis and treatment of labs can help to prevent serious complication. So, did they mention anything? This is also, this is a doctor need to do from, this is what I like. He said a doctor needs to perform a comprehensive evaluation, and he gives what he needs to do, blood test and the others, whatever, do some tests. They need to do it, or the doctor need to do it, but possibility to consider, so they give the infection and others. So maybe this is somehow different than what we got in this This is important notes they mentioned, but also they have mentioned the infection, viral infection, maybe you will have. But what I can see here, also they give the diagnosis test. So they give some diagnosis tests. Also this one, the double I medical. Here they give key consideration. But I mean, both are fine. I don't know. Maybe both are fine. Maybe both are not fine. But doctors, they can do it, or doctors, they can check. But this is what we give you just to check it. And this is now, they are both in leading in the medical field from AI, rather than just to have a general AI. Those AIs, they can be very useful. Also, as I said, if you have a file, you can just attach it here. Especially image, it should not be like a Word or PDF, it should be an image. Otherwise it will not accept it, because they said here image text to text, and it will not work. But also I can see here, this is the same here, but I'm not a bit sure. You need just to check and see if they are the same or no, they are different. Maybe you need just to check before you go to doctors. I don't know if they need to get use of those AI in their description or their diagnosis or their evaluation. So I believe in today's video we give you two very important AI for medical consultation. Maybe they can be useful for doctors, and doctors, they need to give us a feedback or comment. But also I can see it somehow is very used for also patient. I just tried for a person I know, and it gives some good heading, which I like it. Even something it was just absent of the patient mind, but later on when I give him the recommendation, or I give him if he feels that, he says yes and he likes it. He said no doctors, they ask him the same question. So this is to the end of our video. This is double I medical, and this is MedGemma or Gamma, whatever, I don't know what's the pronunciation, right pronunciation this. So I believe we are at the end of our video. So see you to the next video, and goodbye.